Hi, my name is Pavitra Panichalvan. Today I'm going to talk about narrow complex tachycardia. In today's topic, I'm going to talk about the introduction of narrow complex tachycardia, the normal conduction system of ECG, three examples of ECG and the explanation, and together with the other relevant information of the narrow complex tachycardia. The normal conduction of normal ECG is the rate will be 60 to 100 bpm, the rhythm of the ECG will be regular, the P wave of the ECG will be upright in the leads of 1, lead 2 and lead AVF, and also will be 1 before QRX. The PR interval will be constant and within normal range. The QRS duration will be narrow, which is above 120 ms. The QT interval is normal and there is no abnormal of ST depression or elevation. Now let's move on into the introduction of narrow complex tachycardia. The definition for this ECG will be tachycardia heart rate is above of 100 bpm with the QRX complex duration of 120 ms. The indication of narrow complex tachycardia will be supraventricular origin, where the electrical impulse originate above the ventricles, which is from AV node. The QRX complex, which is narrow QRX complex because of the electrical conduction through the ventricle, is normal via the Purkinje system. And then the causes for this ECG will be sinus tachycardia, atrial fibrillation and atrial flutter. The symptoms also will be palpation, dizziness, SOB, chest discomfort. The diagnosis will be the main is ECG, which is narrow QRS, regular or irregular rhythm and P wave morphology. The management for narrow complex tachycardia will be assess stability, which is BP and consciousness, falsafa manus, and adenos if regular and stable, and cardinos if unstable. The criteria for narrow complex tachycardia will be QRX duration is below 120 ms, which is narrow complex. The heart rate will be 100 bpm, which is more than 100, and the rhythm is usually regular but can also be irregular in some types such as atrial fibrillation. And the P wave may be visible before each QRX, hidden in QRX, or absent or abnormal morphology. Now let's move on into the example of the narrow complex tachycardia. This ECG is a long lead 2 ECG. In this ECG, we can also see a broad P wave and also a broad T wave. The P wave we can see which is comes together with QRX complex. In this T wave